All right, from Ebola to breast cancer, it is Breast Cancer Awareness Month, and as times change, breast cancer research changes as well, and thanks to greater awareness, survival rates are climbing, problems are being detected earlier, and treatments are advancing. Joining us now, breast cancer surgeon Dr. Garrett Peel from the Previty Clinic to share some of the facts with us. Good morning.
Good morning.
So glad to have you here. Are you tired of hearing all about Ebola? You ready to talk about something else?
Sure.
All right, so first of all, let's talk about who's at risk of getting breast cancer.
Well, certainly women who are age 40 and above are at risk of breast cancer.
And those who maybe have a history as well.
And we also know that patients who have breast cancer in their family, especially on their father's side, but also women who have family members on either side are certainly elevated risk. There's a model that we use to determine a risk score, and that's why it's very important that if you are at high risk, that you seek discussion with your doctor to talk about your risk. The key here is to understand that breast cancer can kill you, and if it's not caught early enough, it certainly can have devastating consequences. The point is that mammography saves lives, and a mammogram can find a tiny breast cancer, just essentially a few millimeters. We know that breast cancer always starts with a calcification, and we see calcifications on mammography, which is a great thing so that we can identify breast cancers very early before they're even outside of the ducts, much less into the lymph nodes or any other part of the body.
We hear about self-breast exams, but these mammograms are so important too. How often should a woman, say a woman that's not at risk, because I'm guessing they should go every year, if they're not at risk, is it every other year, or do you still recommend after 40 every year?
Every year after 40. If you have risk above 35, then it should be every year after 35.
Okay.
And so important is self-breast examinations. Pick a day, pick your birthday day. So what's your birthday day?
February 12th.
So February 12th. So every day on the 12th, you should do a self-breast exam in the shower, identifying your breast tissue, feeling your under armpit, and then underneath your breast down to your stomach, because breast tissue can go down.
Anything that's different. I mean, anything. And you shouldn't be afraid, I guess, to talk with your physician and not think, oh, it's probably nothing.
And your physician can teach you how to do a self-breast exam, because self-breast exams can really change the course of your prevention. So the thought is, every day on your birthday day, so on the 12th, I'm going to text you every day, every month.
Have you done your exam, Tracy?
And some of my patients have buddies, or bosom buddies as we call them, and so their sister or their aunt or their friend at work, they remind each other that, hey, this is my self-breast exam day, and so they will remind each other to do that. Because
and what are you looking for?
You're basically feeling your breast tissue. You're seeing if there's any abnormality.
And when you say abnormality, like
so is it more painful in other ways or not? Do you feel a new lump? Is there changes in the breast size? Is there swelling under the armpit? Is your nipple changing? Do you have discharge from your nipple that you haven't had before? A colored discharge is always very important to talk to your doctor about. And so again, the more you know about your breasts, the more aware you are about your risk.
Haven't we come a long way? I mean, not too long ago, you couldn't sit and have a chat about this without someone feeling like, but that's why we've made so many advances, right? Because women are better informed now.
Mammography and self-breast exams and a woman becoming aware of their breast saves lives. The key is to catch these very small changes in the breast so that we can go and basically provide surgical treatment, oncological treatment, radiation treatment to prevent the recurrence and then also save the life.
All right, so after you find that, the next step then, talk to your doctor, and if he says, yeah, it's curious, then schedule that surgery.
Right. We don't usually go to surgery first away. Usually we'll do a biopsy, ultrasound-guided biopsy or mammography-guided biopsy, right there where you had your mammogram done, so that the woman doesn't have to have a large incision. It's a minimally invasive approach, and then it also gives us an opportunity to diagnose and see what kind of potential cancer this is so that we can tailor the surgical therapy from there.
And there's so many options now. It doesn't take a mastectomy anymore.
No,
right?
we certainly can focus on saving the breast tissue and revolutionizing how women perceive their breast cancer. We can save lives with surgery first off. The cure to breast cancer is usually surgery.
And I love that we have state-of-the-art technology right here at your clinic,
right here in Southeast Texas. That's right. That's
Yeah,
right.
it gives women a lot of peace of mind. All right. And next week, what will we be talking about?
The different treatment options. So
Okay,
the
the
different
surgeries and the
surgeries,
treatments,
the kind of treatment that you either need before or after surgery. So we're going to go down that journey together.
All right. Thank you so much. Always a pleasure to have you. Thank you so
Absolutely.
much for
Have a
stopping by
wonderful
this
day.
morning.